Hello and welcome to Borno Restoration, where we bring you updates about rebuilding and developmental efforts in Borno State. I'm Jasita Fida. Today, we take a look at healthcare delivery in the state, and despite global funding cuts, the administration of Professor Babagana Zulum has continued to deliver policies and implement projects for improved healthcare in the state. Before we bring you all this, let's bring you the latest on Borno Today. The Nigerian army has been fighting the war against insurgents for the past 14 years. Many security operatives have paid the supreme price while defending the territorial integrity of the nation. The state governor, Babagana Zulum, has been working closely with the military and other security operatives in order to boost their morale in the fight against insurgency. The governor took the whole day to visit Kukawa local council, about 183 kilometers away from Maiduguri, the Borno state capital. His purpose was simple. He was there to assure them of his government's support in ending the lingering crisis bedeviling the state. Governor Zulum arrived Mongono late in the evening.
I decided to move to some of the local government areas, especially Kukawa local government area. I went there to see the armed forces and gallant civilian hunters and vigilantes, so that we shall motivate them, listen to them very well, and then see how we shall solve some of their own problems. Recently, some of the armed forces men and they have did very well.
The governor also confirmed killing of a notorious Boko Haram ISWAP top commander by the Nigerian troops at Alerok village of Kukawa local council area.
One of the biggest senior ISWAP member was killed. And so we lost some few soldiers also. But they did very well. So we were there to commiserate with them, but most importantly to strengthen their resilience as well as the resilience of the community. We have listened to them and they are doing very well. This is the main reason why I came.
Governor Zulum pledges maximum support to the military, paramilitary, civilian JTF, hunters and vigilantes. This, according to him, will motivate them in their onslaught against the insurgency. The 13-year Boko Haram insurgency has dealt a big blow on the standards of living of people in Borno State. This has resulted to rise in poverty level of citizens. But now that things are back to normal and as peace begins to unfurl its gentle wings, government and development partners have been working tirelessly to bring to an end this suffering. Today, member representing Biu, Bayo, Shani and Kwaya Federal Constituency Mukhtar Aliu Betara, in collaboration with other key partners, have launched an empowerment program to people of the area.
These are my personal contribution to my constituents that supported me. The overall group, the team Betara and the old boys. These are my constituents, they are 150. Some, I gave them 1 million, some 500,000. They should use those monies for agriculture, for farming. Those ones. This one I'm giving them for business.
In addition to receiving training in contemporary farming methods, the beneficiaries received gloves, protective boots, fertilizer, seeds, and a chemical sprayer.
This initiative has been very strategic to the people. It helps in modern agriculture and agro-processing. It also aims in providing job security, food security, and it also boosts local economy.
At this time around, we are swinging against the economic tide. Despite this hardship, we find it uneasy to afford this, but Right Honorable Mutara was able to provide this at our fingertips. In that respect, we appreciate him. We remain grateful for the effort.
Each participant took home 120,000 naira for a total of 60 million naira, and 500 people benefited from the gesture. Residents say this initiative is a bold step in eradicating poverty, and more of it is what Borno indigenes need to get back on their feet. I had a chat with the Commissioner for Health and Human Services, Professor Babamalam Gana, who talked about the vision of the governor for improved health care in the state. He spoke about how the administration is delivering on this vision despite global funding cuts. Here's our conversation. Welcome to Borno Restoration. As the Commissioner, Ministry of Health and Human Services, talk to us on why the Zulum administration has taken issues of healthcare delivery serious in this administration.
Thank you very much, and we appreciate TVC developing interest in the healthcare sector of Borno State. Your viewers may wish to recall that Borno has suffered from insurgency for the last 15 years. During which we found ourselves, we lost about 45% of our healthcare facilities, deleted, eliminated as a result of the insurgency. And this has adversely affected the staff. Some were abducted, some even lost their lives, and some have suffered from post-traumatic stress disorder. As a result of which, the situation became dire in our healthcare facilities. So His Excellency, Professor Babagana Omar Zulum, CON MNI, the Executive Governor of Borno State, decided to rebuild and reconstruct and rehabilitate Borno bigger and better. And that's why he focused on the health sector in Borno State.
The Borno State Ministry of Health has taken the lion's share of the budgets. Talk to us on the brain behind this.
Thank you. The health sector, as I said earlier, had suffered adversely as a result of the insurgency, and therefore we were really diminished in terms of manpower or human resources for health. And even the facilities-wise, to lose about 45% of the healthcare facilities is a lot. So therefore, it is not surprising for a compassionate governor, for a people's governor, to set his mind on the health sector.
Now, talk to us on some of the biggest projects your ministry has achieved under the Zulum-led administration.
Right. This His Excellency has focused on healthcare. Borno State, for the first time in its history, was able to reach or receive, the health sector was able to receive 15% of the budget. In 2024, this year too, we had 15.3 to 39% of the budget put into healthcare. And this has enabled us to achieve a lot. If we take a look into the primary healthcare sector, we have been able to build new ones. We have been able to reconstruct some healthcare facilities damaged. We have been able to revitalize. By that I mean, provisions of, for example, boreholes in these facilities, provisions of solar energy in these facilities, provisions of staff quarters in these facilities, provisions of the drugs made available in these facilities. So this has taken place. And also in terms of secondary care, His Excellency's administration between last year and this year has seen construction of quite a number of secondary healthcare facilities, for example, and also renovations as well. For example, last year's budget, we had Dambuwa General Hospital brand new, and I'm very pleased to inform your viewers that the construction of Dambuwa General Hospital is now almost finished, and we are really working hard towards commissioning the project by His Excellency, Professor Babagana Umar Zulum. Furthermore, we had the Brigadier Abakari Hospital. This has been renovated and it's been put to use. And also, we're looking at tertiary centers. In last year's budget, His Excellency pronounced the construction of eye hospital in Biu, and also dental hospital in Biu, and also eye hospital in Monguno and dental hospital in Monguno. I'm very pleased to say that in Biu, in the last couple of months, His Excellency has commissioned the Biu Eye Hospital, and also he's commissioned the Biu Dental Hospital. And this places Borno State in a very unique position in Nigeria, because in every senatorial district, we have an eye hospital and we have a dental hospital. And because of the shortage of manpower, which I've alluded to, His Excellency, in his wisdom, decided that we should have a state teaching hospital and a medical school. This is mainly because we're depleted in terms of human resources for health, but also in addition, we've also suffered from, our healthcare workforce, going away to greener pastures. This is colloquially called Japa syndrome, where, people go to advanced countries, in our case in Borno State, people have actually gone to countries like Saudi Arabia, where they feel they get better pay and conditions. So therefore, we need to replenish not only these people, but also safeguard the state from continuous, hemorrhage of our human resources for health to these greener pastures. So as a result, we have now in last year's budget and this year's budget, a lot of resources, finance have been put in so that this hospital, the tertiary center, will come on board. As we speak, we are the medical school is completely ready for taking on students. As a matter of fact, the Kashim Ibrahim State University has started taking on medical students, nursing students, midwifery, dental, etc., etc. And the teaching hospital will be commissioned this year. I cannot give you a specific time, but everything, including the most sophisticated equipments, such as MRI, the CT scan, and all the radiological equipments have been ordered. And as soon as they are available, and we have also gotten the manpower required, then we can be able to commission this facility. So all this has tailored into the fact that we are gearing our system in such a way that we're not only, preventing Japa syndrome by, attracting our people to stay with us, but also we bring in an environment where they will be very happy. For example, in some of in the health workforce that are working outside the state capital, we call it rural posting allowance. They get 30% more in terms of salary if anyone is to be posted outside the state capital. So they get more money.
Bring us up to speed on how the ministry has been handling outbreak of diseases such as cholera, measles, and its like across the state and, in IDP camps.
That's a very important question, and thank you for asking that question. As a prelude to this, your viewers may wish to recall that on the 9th of September 2024, we had flooding in Maiduguri, where about 750,000 people were displaced, and because of the flood. And we created 38 camps where these people were temporarily housed, and we also created 38, outreach, hospital facilities or medical facilities. And that's, was really a wake-up call for us in Borno State. And the flood is a disaster in the context of waterborne diseases would come in following such a massive flood. And thank God, we worked assiduously with the Federal Ministry of Health and National Primary Healthcare Agency. And, you know, we're very grateful to the Minister of Health, who graciously provided cholera vaccine, 1 million doses of cholera vaccine. He also provided 300,000 doses of measles vaccine. And therefore, we did, you know, a massive vaccination campaign, which, thank God, we have had minimum outbreak of cholera during the flooding. And in fact, this will help in prevention of cholera for a couple of years. So therefore, that's one way that we have addressed this issue. But nevertheless, normally we do routine immunizations, and we're achieving 82% in the state. The only places that we're having problems are hard-to-reach areas. Even these hard-to-reach areas, we are working assiduously sometimes with the security agencies, where, you know, they help us go to these hard-to-reach areas, or if it's not possible, they will visit the area and bring us back feedback, and then we can be able to go with them. So this is how some of the so-called zero-dose, you know, children. Zero-dose meaning they've never had any vaccine at all, and therefore we try to avoid it by reaching out to them. And when our people who have gone to other countries, you know, as IDPs, are returned back to Nigeria, such as recently it's happened in Chad, we go there to give them vaccines, and we assume they are zero dose so that we vaccinate them. So that is one way of, you know, preparing to avoid, you know, epidemics, because prevention is better and cheaper than cure.
How concerned is the state government, you know, with the reduction in funding of most development partners, most humanitarian organizations?
Thank you very much. Borno State government has worked with development partners, you know, seamlessly. And our aim has always been, and it still is, that these are going to be sustainable developments, so much so that, you know, development partners know when they're coming in, and they will tell us when they're going, and in between we make arrangements to see that we will take over from whenever they stop. For example, one of the development partners has built an emergency obstetric and pediatric hospital here in Maiduguri. And from day one, when the hospital was commissioned, you know, 30% of the staff of that hospital are from the Ministry of Health, so that they will acquire these skills that the partners are bringing in. And the following year, it will be 50% of the staff will be from Ministry of Health. Until after 4 years, when they're going, we will be completely, you know, run the place by the Ministry of Health and Hospitals Management Board. That's one example. And also, you know, His Excellency, the Deputy Governor of Borno State, commissioned phase 2 of General Hospital in Biu, where, you know, a facility for accident emergency, for X-ray machines, for, you know, and other facilities have been constructed by WHO through funding from European Union, for which we're, you know, immensely grateful. And, you know, but this was commissioned, and we have started using the facility. This shows how we have worked together with partners to actually, you know, for a sustainable development within the state.
How do you see the Borno State care sector without this support coming?
The areas that, you know, not just Borno State, but the whole country, Nigeria, is not prepared, has been the supply of drugs for patients who have got HIV. Unfortunately, these drugs are being supplied by America for over 20 years. And Nigeria has just folded its arm and waited until this recent stoppage has happened. But with the Minister of Health, Coordinating Minister of Health, Professor Muhammad Ali Pate, who has taken vigorous steps to overcome this problem, there has been some emergency, budgeting at the National Assembly to allow procurement of these drugs so that patients who have got these problems will not suffer. And this includes patients from Borno State. Also, the other area is tuberculosis. Again, tuberculosis is an area which is an infectious disease, and most of the funding comes free for many years. And now, with this development from the United States government, Nigeria is working assiduously to overcome this problem by making sure that these drugs are quickly procured and administered to patients. So, as far as Borno State government is concerned, these are the two examples where it's coming through federal to us that we are making efforts, but the others, any other things, we have taken adequate steps to make sure that our people are not adversely affected by this change in government in the United States of America.
As the Commissioner for Health and Human Services, what is your vision, to the people of the state and the message you have for them?
Thank you. That is very important. And as you may wish, your viewers may wish to know, that Nigeria contributes about 30% of maternal death in the world. And this is very serious. And recent statistics from the Federal Ministry of Health has revealed that 132 local government areas have actually suffered, are the ones that are contributing 55% of the maternal death in Nigeria. Unfortunately, Borno State is one of them. We have 13 local government areas in Borno State that are amongst those 172 local governments. This stretches from Bayo, Biu, Hawal, Shani, Dambua, MMC or Maiduguri Metropolitan, Konduga, Jere, Kaga, Gubio, Damasak, and Monguno. These are the 13 local governments. We have already looked into this quite seriously, and in January 2024, I convened a meeting of all the commissioners of health in Northeast, and the theme was how to reduce maternal mortality, practical steps. And during which we made some declarations, and in Borno State we started implementing. This, we have launched a program called Safer Birth Bundle of Care, which is a program that has been successful in Tanzania, where they crushed maternal mortality by 75% and neonatal mortality by 45%. So this program has kickstarted in Maiduguri. I will encourage you to go into the 4 piloting facilities in Maiduguri and see it for yourself, the gadgets that have been brought in, and we're immensely grateful to the Norwegian government because they are fully funding this program. And the aim is to escalate this or upscale this program to especially those 13 local government areas that are known for high burden in maternal mortality. So that's one program that Borno State government, under the leadership of His Excellency Professor Babagana Umar Zulum, is doing. The second one is the issue of malnutrition. Malnutrition affects not only Borno State, but the whole of northern Nigeria. In fact, even in Lagos, there is malnutrition. Even in the southeastern part, there is malnutrition. So we have taken it upon ourselves to introduce a product which is known in Borno State, Tom Brown, to industrialize it so that we can be able to use it to cure and prevent malnutrition amongst children under 5 and mothers who are lactating and mothers who are pregnant. So therefore, this is another big program which the state government under leadership of Professor Babagana Umar Zulum is doing to ensure that there is sustainable development and overcome of malnutrition within Borno State and beyond.
So what assurances are you giving to Borno residents of your commitment to address their healthcare needs?
Borno State has started enjoying, so to speak, 15% of the budget. To whom much is given, much is expected. So we are delivering. We are delivering from the Ministry of Health in terms of various initiatives that is being done. I've listed some of them to you. In this year's budget alone, we are building more hospitals. For example, we are building an orthopedics hospital here in Maiduguri because the demand for orthopedics is so high. We're doing that, and we're building hospital in Gubio. We're building a hospital in Dikwa. We're building hospital in Baga. We're building hospital in Uba, in Askra Uba local government area, and also in Azare in Hawa local government. Hospitals has been taken over by the Federal Minister of Health, and therefore we're building them a new hospital. So all these are happening, and I can assure you that our governor is a promising governor who actually delivers on his promise. So therefore, you will expect in 1 year's time when you come here, you will hear that these hospitals are being commissioned. Like we did last year, we are commissioning Damboa Hospital, Ngaranam or Abakari Hospital, all being commissioned and ready for action.
Commissioner for Health and Human Services, Professor Baba Malam Gana, thank you for your time on Borno Restoration.
Thank you very much for giving me this opportunity.
That's the much we can take on today's edition of Borno Restoration. Thank you for joining us. We'll be back next week for a fresh episode. I am Jessie Tafida. Goodbye.